When I added OMIDRIA, I realized that the pupil would stay dilated during the case, and I was faster during surgery because I was able to see the cortex. I wasn't getting the iris in my INA pit. It was actually shutting down the inflammation the moment I was creating trauma inside the eye. So in a drop-free regimen, we really need as much as we can on our side to help control the inflammation post-operatively. Over the last 8 years, I developed what I believe is the best practice drop-free regimen. During the cataract surgery, I'm adding OMIDRIA. And then at the end of the surgery, I'm adding 0.2 cc's of moxifloxacin. And then 8 millimeters supranasal to the limbus, I'm adding sub-Tenon phenylephrine of 40 micrograms per milliliter in a 0.15 regimen. However, when I added OMIDRIA, I've reduced that dose to 0.1 micrograms per milliliter because of the synergy of the steroid and the NSAID give a 1-2 punch to inflammation in my patients. Many doctors wonder that if you use OMIDRIA surgery, is it going to be there at the end of the case, or is it just in the fluid? And there's a great study done by Donnenfeld, and that research showed that if you use drops for 3 days before surgery, the level of ketorolac in the vitreous is about 3 nanograms per milliliter. When they measured the vitreous concentration of ketorolac at the end of cataract surgery with OMIDRIA use, it was over 2,500 nanograms per milliliter. That's an over 800 times concentration. So we now know and prove that OMIDRIA is not just there for you during surgery, it's going to be hanging around after, fighting inflammation to help with CME and postoperative anterior chamber inflammation. So when I introduced a drop-free regimen and added OMIDRIA during the surgery, it's interesting because during surgery, I was not rushing, but I was done more quickly. Because the pupil stayed dilated, I didn't have to spend extra time touching the iris or having risk during INA. I was capturing the iris, so I was more easily and more quickly able to remove the cortical material. And that's a minute a case, but in 30 cases, that adds up. It's also interesting because there's 17 other doctors at my surgical center working there. And the staff doesn't understand why everyone's not doing a drop-free regimen. Why wouldn't they? Why would they want their patients to use drops? Because they say it's that simple to do during the surgery. So the staff gets it, my patients get it, and my job gets easier because everyone around me happier. By having a drop-free regimen and the confidence that OMIDRIA offers, it's interesting how patients actually understand the benefit. 1 in 4 of my patients that came in were saying that my friend had surgery and they didn't have to use drops. Our practice transformed into one that's not only drop-free, but it showed that we're a practice that's committed to technology, and having OMIDRIA as a partner to accomplish that has been a big part of the success.